Well, Anderson Hospital is a community-based hospital. We're located in the metropolitan area of St. Louis. Um, we see about 90,000 patients annually. We have about just over the 150 beds and about 40 specialties. And so, as Peter was saying, I just wanted to take talk a little bit about what we did to get where we are today. And I was going to start with our emergency preparedness team. So on the next slide, what I have here is a graphic a little bit about how we had things structured. And that structure really hasn't changed over the years. So the team works mostly because the individuals that we have on this emergency preparedness team all have a personal interest in emergency preparedness. So as most hospitals will have, they have an environment of care committee, and part of that we have an emergency preparedness subcommittee. The emergent, that is chaired by our director of EMS and emergency preparedness. That chair, he's a former paramedic, also a nurse, and the chair of our environment of care committee is our administrative director for our facilities, and he tends to have a freak knowledge of all things regulatory. So the administrative director participates on this subcommittee. Obviously the director of emergency preparedness. We have the director of security. There's myself on this. We have the director of our emergency department on there. And I mean, while the CEO is listed there, obviously he's not somebody who actively engages in it, and nor does our chief nursing officer. But I have to tell you that they've always been 100% supportive of the team's efforts. So having drills or participating in community exercises, that's never been an issue for us. So we're very thankful for that. Back to the subcommittee though, it is it's open to all directors, managers, supervisors, or their designees. So from a team composition, I don't think we could ask for a better makeup for this team. But that's not to say we didn't have any challenges along the way. So if I could have the next slide for a moment. We had some logistics issues. Our switchboard has one operator at a time, and they monitor most of the alarms. These are all the static alarms that have the legacy type connections. It's all hardwired into that location. So for bathroom breaks are a problem. Our operator says, she can only go to the bathroom half the time, or and don't even think about going number 2. But in addition to that, when some type of event happens, we have a lot of people who will call in wanting information about what's going on. We have an overhead paging system that everything's connected to it, or to it's all one non-zoned paging system. So whatever you say in one end of the building is heard in the other end. And then we also have some regulatory concerns that we had, where back to our administrative director, and I guess some of you fire guys out there tend to be a little bit neurotic about the life safety code for obvious reasons, good reasons, but it created some challenges in trying to do some upgrades. So if I could have the next slide. And just a little bit about how IT kind of got involved into this. In addition to being the IT director, I work part-time as a police officer in one of the metro area towns, and spent a lot of time with responding, obviously, to different emergencies. But from an IT perspective, kind of just trying to bring it together of how I kind of, became more involved in this, is that IT tends to have a mindset of where we have to work with downtimes, backups, business continuity. So from a hospital perspective, we have 3 internet providers that provide connectivity for us to the outside world. We have 2 telephone companies to provide us phone service. We have a lot of redundancy there. So we're kind of always focused in that space. But we also have that technical understanding. We know that right now the current trends are towards the IP protocol. We have the Internet of Things, but we still have legacy equipment here at the hospital, and I think that's because there's a comfort factor with that. But a lot of that legacy equipment, again, is in that migration stage to an IP environment. The other thing is that we have to have that willingness. We've had that willingness rather to think outside the box. IT spends a considerable amount of time working on analysis, lean principles, just how to make things better. We were so how were we successful? I think part of it was going back to that subcommittee. There were just repeated discussions of the same thing over and over, and everybody, I think, understood all of those issues, but there just weren't the resources that were out there, that were made available to us. And then the Joplin tornado happened, and several of us went to Joplin and heard the postmortem. It was a great presentation, day-long presentation of where it got many of us thinking we just haven't done enough. And part of that, in listening to the folks in Joplin, was just realizing that time is so critical in the first few minutes. And for many of us that are out there that are out in the a first responder, you understand that the fog of war, the information's not always accurate, or you don't have the ability to communicate as well as you could. So what I kind of learned was that I get a little tired of hearing about we'll talk about something, and sometimes it's just easier to ask for forgiveness. So we kind of started off a little bit small with our notification system. We began to add components, and we created a lot of complexity with that. And I think because of that, we found that using the Alertus system as the core of our emergency notification system just brought all of those complexities, and having to teach them from an IT standpoint, teaching the complexities of some of this to the IT staff wasn't so much of an issue, but we weren't the frequent users of the system. It were folks that were switchboard operators or nurses or house supervisors, people that just don't really think of this on a day-to-day basis. So, but I think all these things brought together, all these things happening, I think made us, got us to the point we are today, because the team finally understood. We were able to use many of these events to get where we want. And if I can get the next slide, just some things that you might consider if you are trying to put together a plan and struggling with that. I think we were successful. From IT standpoint, I kind of have some of the deep pockets. Some of our projects we cost a lot, and at the end of the year, sometimes there's a little bit of money's left over that I could use to put to this. But so I would say, if you're going to find somebody in the IT department, maybe if they're too high up on the chain, they might not care about this. They might not take emergency preparedness as seriously as you want, and they might squash your request. But if you go too low on the chain, they might not have an authority to get it done, but they kind of have resources that I think you could use. I'd say, we started off small and let the system prove itself. We started with just the desktop notification. And once that was in place, everybody said, well, could we do this? Could we do this? And because of all those previous conversations we had in our subcommittee, we were like, sure, it can be done. This is what it will take to get that done. And I think, we had to have a good understanding of the regulatory requirements. While our administrative director has a great knowledge of all that regulatory stuff, I didn't. And it took me a while to get up to speed on all the environmental care or all the life safety codes, and just beginning to understand it. But once I did, I was really able to use that to the advantage and pushing our processes, our needs forward. So hopefully that's a little bit of how we were successful with it. I do think it was a lot with the people and the dynamic, but maybe those are things that you could consider with your team.